Hello everyone, I'm Satpal Singh Shekhawat. I'm a GP at Curtin Lindsay Surgery, and today I'm just doing a short video to show how you can create a protocol to help with renal transplant patients registered at your list. So firstly, you would need to have a document which is available on the internet. So if you search for GP prescribing information, adult renal transplant, Hull York Hospital, this will bring up this PDF document which you can have downloaded onto your computer tops or desktops, and that can be allowed to copy and paste into the information. So for example, in this, what we're using is the interactions with medication and what medicines we should avoid for prescribing for patients. So in this is the copy-paste medications to avoid, which you can use onto the protocol. Now going on to SystmOne, I had created a protocol for our practice, so I'll talk you through that. So if I just show you the details of the protocol, and once I click into amend, you'll be able to see the buttons. So the first thing is, when you're creating one, you will put details. So you'll put your protocol name, which is the renal transplant prescribing protocol. I've created a category for prescribing. I've used an icon, which is a kidney icon, just to alert, easy to find. And in the description, I've put protocol to alert prescribers on what medications to avoid for renal transplant patients. In trigger, I have kept both manual and automatic trigger. And the triggering protocol, from this we have selected patient record retrieve. So as soon as you are going into patient records, a pop-up box will appear. It can open up with multiple protocols, and I have restricted triggers to different roles. So it will only pop up on clinical practitioners, doctors, GP trainee, nurse access role. In your own organization, you may have different roles set up. So you're trying to set it up so that unnecessary pop-ups are not happening. In terms of filters, we've not applied any filter, but we have created that it applies to patients in report, and I'll show you later how to create a report, because essentially you will have to have a register or a report which identifies all your renal transplant patients. So it will only open up when those patient records are retrieved. And then once you go into the design element, it's very simple. So we've just created a start button. The action we want is information. So I've created the information box, and in the information I have copied pasted the medications to avoid, which you will be able to see. So that's the box which will pop up if you go into any patient record. So once I cancel this protocol, I'll just show you how you can go into that. So for making protocols, you will go into setup, you will go into workflow support, go into protocols, and once you go into it, create a new protocol, and then you will follow the design I've just shown you. In order to create the report, you would go into reporting, you go into clinical reporting, and in clinical reporting you can create a new report which you can name it as renal transplant patients. In this case I'm not going to do it because this is a live record. And then once you've done it, you would choose how it will pick up your patients. So in this case you would use a coded entry, and in the coded entry you would then select which code you want. So you can go into the select codes and use, for example, renal transplant. Now this includes different types of, so this SNOMED code will be sufficient to identify those patients. Once you've done that, you will run the report like we have here, and if I run it, it will bring up the patients. So like this morning we've got 5 patients in our list, and that list you would import into your protocol. So I hope this helps you in creating your own protocol for your own organizations, and I'm sorry it can't be done for all organizations because it has patient identifiable information, so you'll have to create your own list and match it with the protocol, but it will help in safe prescribing. Thank you very much.